And now looking at the COVID situation in the country, you will now be able to get an additional COVID-19 booster shot 6 months after completing your primary doses. This is among other changes that the Ministry of Health has now ordered county directors of health and their teams to effect as the country strives to hit the 10 million people mark of people who have been vaccinated against COVID-19. Raquel Muigai reports.
10 months after the country started vaccinating its population against COVID-19, and some changes have been made by the Ministry of Health regarding the COVID-19 vaccination program. In a circular addressed to the county directors of health by the Acting Director General of Health, Dr. Patrick Amoth, pregnant women should be offered the mRNA vaccines, which is Pfizer or Moderna, at any gestational age, at first antenatal care clinic visit or first contact with health services. Those who began vaccination with other COVID-19 vaccines should complete vaccination using the same vaccine. Additionally, people who have completed the primary COVID-19 vaccination series should be offered an additional dose of either AstraZeneca, Moderna or Pfizer vaccine 6 months after completion of primary series. The letter notes a similar or different vaccine can be used for the additional dose. Where a serious adverse event or reaction has been reported after vaccination, an individual should be switched to a different vaccine type for completion of the schedule as per the original timelines. For example, if a reaction is reported after Pfizer or Moderna administration, AstraZeneca should be offered for second dose 28 days after initial dose. If it was AstraZeneca, then Pfizer or Moderna should be provided as second dose 8 weeks after initial shot. The DG also says that individuals who received first dose of Moderna can receive AstraZeneca as the second dose 28 days after Moderna shot was administered. So far, 3.9 million people have been fully vaccinated, with another 5.6 million partially vaccinated. With the government banking on proof of COVID-19 vaccination to access public spaces and services as a measure to contain the spread of COVID-19, especially during the merrymaking season, the Catholic Church has spoken loudly against the directive.
We have taken exception and we have said we do not agree with the government position. We believe that such laws are done when and only there is lack of proper planning and coordination. You cannot take away the human rights of our citizens to be served.
He has, however, asked Kenyans to come out and get vaccinated.
If you get a cold like I got, make sure you get checked so that it is not COVID, you don't pass COVID to others. And avoid any kind of unnecessary interaction.
This comes as the country recorded 3,479 new COVID-19 infections out of a sample size of 11,460. The country's positivity rate now stands at 32.7%. Raquel Muigai, Citizen TV.